Assalamu alaikum. I hope so you're doing fine. I'm Dr. Muhammad Ali Rabani. Let us discuss the muscles of the dorsum of the foot. For that purpose, let me shift to the model right here. This is the extensor hallucis muscle. It can be divided into two parts. The one going to the digits, except minimus, that will be extensor digitorum brevis, and the part that is attaching to the hair on the big toe, that is the extensor hallucis brevis. This one. Okay, let's talk about the digitorum, and it arises from the calcaneum, from the dorsolateral aspect of the calcaneum, as you can see right here. It is rising from here, and it is getting inserted into, it is getting mixed with the extensor expansion of the long tendons. So it is majorly inserting into the proximal phalanx. By the way, I have found this very helpful, that the longer the muscle, the long for a large number of muscle there are longus and brevis. Longus usually arises from further backwards and attaches distally, further distally. The brevis muscle starts in the near proximal and ends in the near distal. So it is arising from the calcaneum bone, and it is attaching, as you can see right here, it is attaching into the middle phalanges as opposed to the distal phalanges, as was mentioned in the longus muscle. So if we talk about this muscle, sometimes discussed separately, sometimes similarly. So it is also arising from dorsolateral aspect of calcaneum, and it is inserting into the proximal phalanx of the big toe. Keep in mind, the extensor hallucis longus was getting inserted into the distal phalanx of the big toe. And the function, as its name indicates, it will be simply to extend the big toe at proximal interphalangeal joint. Keep in mind, it will not affect the ankle joint, as it is not crossing it. And the extensor digitorum longus, extensor digitorum brevis will, and similarly extensor digitorum brevis will be responsible for extension of the proximal interphalangeal joints of the lateral three digits. I mean digit toe number 2, 3 and 4. It is not getting inserted into the little toe. So that's it, and that's about the muscles that you need to know. And both of these muscles are supplied by the that is nerve, that is the that both of these are supplied by this nerve, that is the lateral branch of the deep peroneal nerve. So we're talking about both extensor digitorum and extensor digitorum brevis and extensor hallucis brevis. So that's about it. If you have any question, suggestion or feedback, please let me know. And next we'll talk about the dorsalis pedis artery and the deep peroneal nerve. Then we'll move on to the other compartments of leg. Thank you so much.